I have a special guest, Ralph, from Volpara Solutions in Wellington, New Zealand. Welcome, Ralph.
Hi Liam, how you doing?
I'm very well, thank you. I was hoping you could just open us up with a little bit of background on Volpara Solutions.
Volpara is an AI company based in Wellington in New Zealand, but with a global business. We apply AI to breast images, and our focus as a company, and my focus for the last 30 years, Liam, is the early detection of breast cancer. Earlier you can detect it, the much higher probability that the woman will go on to live a long and happy life, and much lower treatment costs as well.
I've put here, what was your first job?
My first job was a software analyst for a company called SKF. So I grew up in Luton in the UK, just north of London. There was an SKF, which is a ball bearing company. I went along there and got involved in modelling, mathematical modelling of how the bearings wear and what kind of greases you need to apply to them. That was my first job.
Now you're a CEO of a 300 million plus ASX listed company. How did sort of that happen? So how has your journey sort of come to be in your career? You kind of touched on it.
Yeah, no, I think it's a great question. I think a lot of my early career, I really had very little knowledge of what I wanted to do, apart from, I wanted to get away from Luton for various reasons. If you've ever seen the film Blinded by the Light,
No.
which is a great film.
Okay.
No, I'd recommend you go and see that. You'll understand where I come from. But yeah, I was always good at maths. So I went to university, did maths, went to Oxford, did computing, just to see what computing was like. And then I started realizing that actually I was a researcher at heart. That was my core strength.
Okay.
And it was like a duck on water. I was like, actually, I'm a researcher. I didn't understand what research was at that point. So I got stuck into that, and I realized this is what I wanted to do. But I got tired of academia. I was tired of these academics publishing papers, the same thing time and time again, just to get their number of publications up so they get more grants. I was always like, well, this is never going to work in public. It's never going to work in reality. Start publishing stuff that's going to work. In parallel to that, I'm a big football player or soccer player, and so I started running football clubs. And we went from one men's team in Oxford up to 3 or 4 men's teams, winning things. But also we started a women's football club, and we got that from nothing up to 3 teams. I really enjoyed the management and running of things, and that really said to me, let's get into startups. I'm enjoying running, organising, but also I'm enjoying applied research stuff that's going to work in reality. So that kind of led me into startups in Oxford. The first startup we did there, we did really well. We tried to exploit the breast imaging work we'd done in my PhD, but we realised the clinical world wasn't ready for it. So we went into brain imaging. We were very successful at that and sold the company, at which point I could move to New Zealand, where my wife wanted to come back and finish her medical degree. Right. And then 2009, we set up Volpara.
I also like that link that you acknowledged that from the football management, that was kind of a big part of who you are as well. Like that you wanted to be a leader and you wanted to be around teams, and it wasn't just the research and analytical skills. So I've put here, Volpara has operations in the USA. How do you find the headquarters being in Wellington? Is location important?
Yeah, so again, I think it's an interesting one. In 2009, we could have started the company anywhere in the world. Yeah. We chose Wellington because I was based here. At that point, we didn't have kids, but we chose Wellington because the government was very supportive. And in particular, there was an excellent IP lawyer in Wellington, and so some government funding, some friends, and we kind of got going. We then realised there was lots of very good software engineers here. Yeah. Plus, as we were talking about a bit earlier, the film industry is quite big in Wellington, and the film industry involves lots of people who know about computing, but also know about images. Okay. Yeah, roll on now, right? We've got 27% of the US market is using our software. Half the companies based in New Zealand and half in the US.
Would you say that Wellington, so that location is more the development side, and the US is more the market side, the go-to-market. Is that the?
Yeah. So 95%, I think, of our revenues come from the US.
Yeah.
So Wellington is R&D, it's engineering, it's admin, it's the finance, it's investor relations, and so on.
Okay.
US is run, it's sales and marketing, it is customer operations, and so on.
I put here, what problems are Volpara looking to solve?
Yep, we are huge fans of breast cancer screening. 500,000 women a year die of breast cancer around the world. So although it wasn't classed as essential, breast cancer screening is a critical service. So even after COVID-19, it's now pretty much up and running again globally. Our mission is to reduce drastically that mortality rate. Now, we are big fans of breast cancer screening. There was a recent study which showed, from Sweden, showed a 41% reduction in breast cancer deaths. So that's good, but everyone knows that there's multiple ways you can improve breast cancer screening. One of which is that if your breast, if a woman walks in and her breast is what they call dense or full of fibroglandular tissue, those women are more likely to develop breast cancer and more likely to have their cancer missed at breast cancer screening. So one of our jobs as a company is to provide accurate, objective measurements of breast density or breast composition, so that the radiologist really decide what risk that woman is at, and potentially offer her extra imaging to find the cancer early if necessary.
And because this is the density, the scorecards, right? Is it this? Yeah.
Yep.
And that's what I really liked as well. I liked that taking it away from, the manual eye, the doctor's sort of opinion of how he sees it, interprets it, and making it more about, again, going back to the data, right? The data-driven decisions.
Last year, then, we brought a company called MRS over in Seattle. MRS has a 20% market share in the US of patient tracking software for breast, but also it has 8% of the market share for lung cancer screening as well. So it's an important part of our future, although it's not number one priority at the moment.
But here, what's the big goal for Volpara?
Is to move into this next generation of predictive healthcare. Yeah, we want to get to a point where we can predict breast cancer early on, at age 35 or so, for example, and say, look, you really are high risk of developing breast cancer. We are going to do preventative measures on you. So that's really our aim and focus at the moment, moving it even from early detection, even down to prevention.
I've put here, who are some members of the Volpara team that you'd like to publicly recognize?
The team right from the start has been a joy to work with. Some of the founders, Professor Sir Mike Brady. Professor Mike Brady, I've been working with for the best part of 30 years. Very, very inspiring, very innovative, very future-looking. People like Nico Casamar, incredibly, like me, with a real focus on practical image processing, practical AI that works. Through to more recently, I've really enjoyed interacting with a lot of the US team over the last 5 or 6 years.
I've put here, how do you wind down or switch off after a big day in your role?
So, as I indicated earlier, I'm quite a sporty person. So I've always found I do quite a lot of taekwondo or playing indoor soccer.
Nice.
Any of these things that they help you wind down.
Yep.
And more recently, I know you know Wellington a bit. I've started to go running up in the hills above Wellington. I do have 2 small kids. They often help me wind down. Not always.
How old are the kids?
7 and 10.
Right. So very active.
Just a bit older.
Yeah.
They are very active. Yeah. I'm getting them into playing cards and other games.
Wait till they start playing football. You'll be their coach.
I will be, yeah.
And the last thing I've put here is what can the public do to support this great company?
But I think the main thing for the public to do around Volpara is be aware of breast cancer signs. You learn about breast density. Go online and read about breast density and learn about high image quality and breast cancer screening.
Okay, well, thanks, Ralph. Is there anything else that you'd like to add before we clock off?
No, thank you for the time, Liam. That was good.